In this video we're just going to scan the structures down the plantar aspect of the tarsus. We're starting just distal to the tuber calcanei, and then we're going to work down in 2 zones from the tuber calcanei to really the head of the splint bones. So that covers the tarsal region, and we split that into zone 1A and 1B. So starting with zone 1A, we're just coming just distal to the tuber calcanei. We can actually see the surface of that there on the scan. If I freeze that, we're on the midline there. We can see the superficial distal flexor tendon, and we can also just see the edge of the plantar ligament, which starts just about 2 or 3 centimetres distal to the tuber calcanei and lies slightly laterally down the plantar aspect of the tarsus. If we unfreeze the image and just move around medially, and then we adjust the image. And freeze there, we can then see that medially to the plantar ligament, and also dorsomedially to the superficial digital flexor tendon, we have the deep digital flexor tendon, which is ovoid at this stage. There may be some fluid between the deep digital flexor tendon and the plantar ligament, which appears as an anechoic line, and that's just fluid within the tarsal sheath. So that covers zone 1A. If we unfreeze and just start to come distally, we find we have superficial digital flexor tendon in the middle, and I can freeze that. We can see most of the extent of that. We find if we want to get the medial and lateral borders, we may have to rock the transducer just medially and laterally slightly. But what we can't really see is much of the deep digital flexor tendon and the plantar ligament. That's because the plantar ligament lies laterally and the deep digital flexor tendon lies quite medial at this stage. So what we need to do then is adopt almost a 3-pronged attack in terms of scanning, so that we make sure we view all of those structures. So midline for superficial digital flexor tendon, we will then unfreeze and come medially. And optimize that for the deep digital flexor tendon. So we can see that there is an oval structure just slightly to the right of the midline of that image. And then unfreezing that, good lad. We come laterally. Good chap. And we can get the fibres of the plantar ligament then on the lateral aspect of the leg. We can also have a look at those structures in longitudinal section. So again, on the midline, optimise our image. Good chap. We can have our superficial digital flexor tendon coming laterally. So coming laterally, we can then see the plantar ligament. And if we come medially, we can see the fibres of the deep distal flexor tendon as well. That constitutes the plantar tarsus.